Hello, my name is Aaron Benson. I'm a family nurse practitioner student at Maryville University. This is my head-to-toe assessment for Nursing 612. My patient today is Rachel. Just to start my general assessment, I would start with my ABCs. I would look for airway, breathing, circulation, seeing that she is breathing in no distress right now, seeing that her skin is normal for ethnicity, it is pink and dry, and no obvious deformities. Before I begin, I would also get a full set of vitals, including temperature, heart rate, respiratory rate, oxygen saturation, blood pressure, pain level, a height, a weight, and then I also do a distance vision testing with a Snellen chart and a near vision testing with a Rosenbaum chart. So starting at the head, I would first inspect the head and the facial features. First looking at the skin, looking for any abnormalities, including rashes, lesions, lacerations, anything like that. I would look to see that the head is normocephalic and look at the quality of the hair, seeing that it is full, free of nits, dandruff, or excess grease. Palpating the skull, I would palpate the bones in the skull, feeling for any masses or indentations, and asking about any tenderness. Okay. Moving on to the face, I would see that the facial features are symmetrical, that the top of the eyes are even in line, the top of the ears are even in line with the corners of the eyes. I would see that everything is symmetrical from side to side on her face. I'm also expecting the skin for any abnormalities. On to palpating the facial bones. Going through palpating from top to bottom. I'm asking about any tenderness or feeling for any abnormalities or any masses. If I could have you open and close your jaw for me. Thank you. I can see that she moves her jaw open and closed freely, and I feel no crepitus. And I would ask about any tenderness when she opens her jaw when I'm palpating the TM joint. Palpating the sinuses. I'd be asking about any tenderness in those areas. Okay. Moving on to the ears. I don't have an otoscope with me right now, but first I would inspect the ears. I would look at the external ear first. I would look to see if there are any abnormalities, any obvious drainage, and palpating the ear to feel for any masses and seeing that the earlobes move freely. Okay. Then I would take my otoscope, I would look into the ear, and I would first inspect the external ear canal, looking for any irritation, any foreign bodies, or excess cerumen. And then I would visualize the tympanic membrane, seeing that it is pearly gray is a normal finding with the cone of light in the appropriate position, depending on which ear. After that, we would do just some simple hearing tests. I would use a tuning fork and do the Weber and the Rene tests. Testing bone conduction, I would hit the tuning fork, place it on the top of her head on a bony prominence, and ask if she's hearing it the same in both ears. For the Rene test, testing that air conduction should be double that of bone conduction, I would hit the tuning fork again, place it on the bony prominence behind the ear, and when she could not hear it, I would move it out about 2 inches away from the ear. She should be able to hear it about twice as long as she did the bone conduction. The next test I would do is the whisper test. I would step behind the patient. I would have her close one ear. Thank you. And I would whisper one word into each ear and have her just repeat them to me.
Orange.
And then the other ear.
Apple.
Good. Onto the eyes. First I would inspect the eyes and the eyebrows and eyelashes. I would see that the eyebrows are uniform and full. The eyelashes are also full and they curve appropriately. The upper ones curve up and out, and the lower ones curve down and out. I'd be looking for any excess drainage or discharge. I would pull down. I'd look at the sclera and conjunctiva. I'd be looking for any redness or any discoloration or yellowing and jaundice. I would also palpate the lacrimal apparatus, looking for any discharge or asking about any tenderness. Also inspecting the pupils. I'm going to shine a bright light in your eye. I'm looking for the pupils to be equal, round, and reactive. And then I would do it the second time and look at the opposite eye. Just look straight ahead. Thank you. And I'm looking at the opposite eye to constrict as the same as the other one. This side. All right. And then I would have you cover one eye for me. And I'll be looking at the opposite eye. I'm looking for any drifting or nystagmus. And then the other eye. And nothing was noted there. You could follow my fingers just with your eyes through the 6 cardinal gazes. I'm looking for any nystagmus. Thank you. And I could also do a peripheral vision test at this time. Moving on to the nose, I'll have you look up just a little bit. I'm looking at the external nose first. I'm seeing that the external septum is midline and that the canals appear to be open with no obvious foreign bodies. Looking up into the nose, I'll be looking at the mucous membranes, the turbinates, and the septum. The septum is midline, and the mucous membrane and turbinates are pink and moist. You could cover one nostril for me and breathe in and out. And then the other one. Thank you. All right, they are both patent, and at this time I could also check cranial nerve number 1 and check her sense of smell. Moving on to the mouth, I would first inspect the lips, seeing that they're pink, full, and moist, and appear to be symmetrical. If you could open for me. Thank you. Raise your tongue up. I'll be looking at the teeth first. I'm looking for any abnormalities, any cracks, missing teeth, caries, anything like that, noting that there are a full set of teeth. I'm also looking at the gums. I'll be using a tongue depressor for this, but I don't have one. I'm looking at the gums. I am looking for them to be pink, moist, and free of any excess masses or redness. At the floor of the mouth, I'm looking for any masses or discoloration. Looking at the hard and soft palate, I'll be looking for the same, any discoloration, any masses. Go and stick your tongue out. Say ah. The uvula does rise midline. I'm also looking at the anterior and posterior arches. Looking at the uvula and the tonsils, I'll be looking for any redness, any discharge on any of those. I think that should be it for the mouth. Right, farty. Yeah. Moving on to the neck. Oh, on that one I could test a sense of taste also. Moving on to the neck, I would first inspect the neck, seeing that the trachea appears midline. The neck is full and supple. Palpating the neck, I would start with the carotids. I would do one at a time. And I'd be noting the rate and the rhythm. Then I would palpate the trachea, seeing that is midline. I'm feeling for any masses. And then for the thyroid, go ahead and swallow. I'm feeling for any masses, any goiter, or any abnormal lumps in the thyroid. Swallow one more time for me. Thank you. All right. For a range of motion exercise, I would have you look up, down, then look up, then look straight ahead, turn your head to the left, and then to the right, and then look left, and then look right. Then I would do the same against resistance, so down, keep that up, and then push against, and again, and then turn against. Thank you. Shrug your shoulders. Thank you. Those are all equal movements from side to side. Palpating the lymph nodes, I would start with the occipital. I'm feeling for any enlarged or swollen lymph glands. Do the post-auricular, the pre-auricular, the tonsillar, the submental, the submandibular, the deep cervical, the anterior cervical, the posterior cervical, the anterior cervical, then the deep cervical, the supraclavicular, the infraclavicular, and if you could raise your arm, do the auxiliary, and then the other auxiliary. Okay, and I feel no swollen lymph nodes at this time. If I could have you spin the opposite direction for me. Thank you. Moving on to her thorax, her chest, and her back. We'll start with the back. First, I would inspect the skin, the quality, the color, and looking for any abnormalities. I would also inspect for her effort and rate of breathing, seeing that the chest should, or the thorax should rise and fall without difficulty and symmetrically. Also, just inspecting for any abnormalities in the skin. Palpating through the thorax, I'm feeling for any masses, asking about any tenderness. Sides. Okay. And then testing for tactical firmitus, I would have the patient say 99.
99.
Over and over again.
99. 99. 99. 99. 99. 99.
One more time.
99.
Okay. And I'll be feeling for a resonant feeling on the back of on the side of my hand. It shouldn't be hyper-resonant or dull, and it should be uniform throughout. Going through and percussing through her lung fields, I should hear a fairly tympanic sound, and it should be uniform throughout all lung fields. Good. Then I would test for costovertebral angle tenderness also. I would be hitting on both sides, feeling for any tenderness. And if you could take a deep breath in. And I'm feeling for the thoracic expansion. My hand should move uniformly when she takes a deep breath in and out. Now do lean forward just a little bit. Take a deep breath in and blow it all the way out and hold it out. Okay, then take a deep breath in and hold it. And those are the two spots that I would mark. You can breathe normally. Those are the two spots that I would mark for her diaphragmatic excursion, which appears to be about 4 centimeters. Normal is 3 to 5. Listening to her lungs. I'll be listening for any rhonchis, rales, rubs, wheezes, or crackles. I'm going to sit up. Just sit comfortably and just breathe in and out. One more time. Okay, keep going. One. Good. Turn back towards you. We'll go on to your chest. I would do the same inspection. I would note the rate and the effort for her respirations. I'm looking for any abnormalities, any masses, lesions, any obvious deformities when I'm doing the inspection. Also looking at the color and quality of her skin, looking for any rashes, lesions, anything like that. I'm also looking for any thrills or heaves when I'm looking at the precordium. I'm just going to palpate through the chest, feeling for any masses on her rib cage or thorax. Okay. Moving on, I would palpate through the tactile firmitus again, just 99.
99. 99. 99. 99.
On the side.
99. 99.
Okay. And also palpate, excuse me, through the precordium. You just rest and breathe normally. I'm feeling for any thrills, heaves, or pulsations. Through the apical, pulmonic, herbs, tricuspid, and mitral points. I'm feeling for the point of maximum impulse also, Oh, yeah, we can let the cat out, I guess. 1 second.
Lay down.
Moving on to percussing the chest, I would do the same thing as the back. Should be noticing the resonant sound throughout the chest, on the sides. Okay. I would listen through the lung sounds again, and then listen through the precordium, listening for the S1 and S2, also listening for any adventitious heart sounds. Deep breaths in and out. Just breathe normally. Okay. While I'm here, I can also auscultate for bruise in the thyroid and each carotid. Okay. Moving on to the abdomen, if I can have you lay down, please. First, I would inspect the abdomen. I'm looking for any discolorations in the skin, any masses, lesions, obvious pulsations. I'm also using a pen light to look at the contour. And I'm noting the quality that is round and flat. First step would be to auscultate for all the bowel sounds in all 4 quadrants. I'm noting the quality and the quantity of the bowel sounds in each quadrant. You should listen to each quadrant for at least 15 seconds. Listening if you can't hear anything for up to 2 minutes. I would also at this point listen to the aorta. I'm listening for any bruise in the renal arteries, the iliac arteries, and the femoral arteries. Okay. On to light palpation. I'm feeling for any masses, any herniations. I'm also looking at the patient's face to see if there's any grimacing with the palpation. On to deep palpation. Palpate a couple inches deeper. Feeling for the same. Okay. I would also percuss through all the bowel sounds, or bowel quadrants. Should hear a nice resonant sound throughout from the bowel. I could also, from here, I would check the span of the liver by percussion. I would listen for a dullness, which starts right there. Then start from the top, work my way down, which is right there. Normal is about 8 to 10 centimeters on that. I would also percuss for the splenic dullness over on the right costal area, and it is right there. Continue with the palpation. I could also palpate for the border of the liver. I would go down to the right costal margin and see if I could feel the border of the liver. And while I'm on this side, I'll have you roll over onto your left just a little bit, and I would try to palpate the right kidney And then if you wouldn't mind laying back, flat on your back again, I would try on the left costal margin to palpate for the spleen. I should not be able to feel it. It's a normal finding. And then roll over towards me. I would try to palpate for the right kidney. Okay, go on my neck. Last part of this, I would just use my fingers here to try to feel for the abdominal aortic pulse. And then the renal pulses. Not renal, femoral. Okay, have you sit up on the edge of the bed again. Moving on to the extremities, I'll start with the upper extremities. I'm looking at the muscle tone and the overall structure of the arms, inspecting the shoulders, upper arms, lower arms, hands, and fingers, and looking at the fingernails. I'm looking for any clubbing, any cracking, discoloration. Excuse me. Okay. On to palpating, just feeling for any abnormalities, and asking about any tenderness throughout. I'll be feeling for the pulses in the brachial. And then in the radial. Okay. Then testing for the brachial reflex. Okay. Then through a range of motion exercises, arms straight out, then bring them forward to me, push up against mine, and then pull down, and then back out, push up, and then pull down. Fantastic. Go on, just relax. And then looking at the legs, I'm noting the color of the skin, quality of the skin, looking for any abnormalities. I'm looking at the hair and the muscle tone, feeling for any abnormalities and asking about any tenderness throughout the legs. Also, again, looking at the toenails, looking for any discoloration, cracking, or clubbing. I'll go and start feeling pulses at the dorsal pedis, the posterior tibial, and each popliteal. Just relax your leg. And then testing for range of motion, just leg straight out, and then back down. The other one, good. And then against resistance, push against, and then pull, and push against, and pull. Okay. Testing the reflexes, I'll start with the patellar. There it is. Okay, and then I also test for the Achilles. Okay. All right. To do a quick neurological exam, I would have the patient raise their eyebrows, squint your eyes closed, puff out your cheeks, smile, stick your tongue out. All right. And then clench your jaw closed. I'm feeling for the contraction of the muscles in the jaw. Then I would do a light and a sharp sensation test throughout all her face and limbs. Close your eyes. And you're going to feel me touch on your face first in a couple places. Just tell me if you feel sharp or dull.
Dull. Dull. Sharp. 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 It's hard to tell.
Okay.
Dull. Dull. Sharp. 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 Do that one again. Dull. Dull.
Okay. Let me just remember some things that I forgot. If I could have you lay back down one more time, there's one thing I forgot on the abdomen. It'll be real quick. Just give me a crunch. And I'm looking for any herniation or any bulging in that. That's all I need from that. Sorry.
That's okay.
If I can have you one last thing, just stand up. I'll be noticing the effort and how easy it is for her to stand up. If I can have you turn and face that way, bend over. And from here, I'll be inspecting the back and the spine, looking for any abnormalities. I'm going from the cervical down through the lumbar spine. I'm looking for any herniation in the disc or any bulging or any abnormalities. I would also be palpating through that. And I'm looking for the normal curvage of the spine, looking for any scoliosis or bending like that. Okay, go and stand up. And that should conclude my assessment. Thank you.
Maybe I'll